Mental Health Commission of Canada, Commission de la santé mentale du Canada. Living Hope was a 4-year community-based implementation plan collaboratively developed to move the Edmonton suicide prevention strategy into action. In 2019, Living Hope aligned with Roots of Hope, a community suicide prevention model from the Mental Health Commission of Canada, due to similar alignments between the activities, guiding principles, and goals. Participation in the Roots of Hope research demonstration project infused Edmonton's efforts with additional funding, fresh hope to create future sustainable action plans, and the opportunity to contribute to a ripple effect felt by the Roots of Hope communities across Canada.
My name is Glynis Lieb. I'm a social psychologist by trade, and I currently am the executive director of the Institute for Sexual Minority Studies and Services at the University of Alberta in Edmonton. One of the things that stood out to me about this project relative to the many other initiatives and projects I've been part of throughout my years is the fact that this has been about actually doing concrete things, not simply writing reports, not simply, coming up with plans, but actually doing tangible things. And by the end of the first phase of the local Living Hope initiative, we actually had done things such as create a LGBTQ plus dedicated crisis support line, for instance, and create support groups, a men's support group and those sorts of things. So that meant a lot to me.
I'm Punch Jackson. I'm 77 years old. I'm retired, and I'm the volunteer chairman for Men's Sheds Association of Edmonton. Living Hope gave me the opportunity to share the Men's Shed story where we think it fits in the overall suicide prevention strategy, and where we think it fits as a tool to support men in on a wide spectrum or continuum. It also gave me the opportunity through participation in the committee to hear the stories of impact of suicide on families.
My name's Wesley, and I'm a suicide prevention advocate. The project has helped me feel like I have something to give to society. It's helped me give back and turn my own lived experience of suicide into something meaningful. It's made me feel like I can help the people around me and do something unique and interesting that will have a lasting effect on my community.
My hope is that we continue on and don't get lost in the depths of the project, if that makes sense, and that this push towards continuing to be more and more philosophical and theoretical about what's needed. I want us to continue to keep people with lived experience from the community at the forefront and leading this, rather than the folks like myself with letters behind our names. I think we need to be told what to do by members in the community who are directly impacted, and we need to find ways to make that actionable. And so I really want to impress the urgency with which we need to continue to listen to the people that we're trying to support and find ways to make what they need to happen.
I'm not entirely confident we'll get to zero suicide in my lifetime, but I would like to see the numbers go down quite a bit. And I would like there to be more supports for people who have attempted, because it's really hard to pull people out of the weeds before it happens, but it's really easy to see people after it happens. And I think that we need more supports to help people get back to a normal type of life after.
Mental Health Commission of Canada, Commission de la santé mentale du Canada. mentalhealthcommission.ca